This is Reena Jadhav here at Vader Splash, having a fabulous conversation with Duffy of Omada Health. Hi, Sean.
Hi, how are you?
Good. So tell us a little bit first about Omada Health.
Yeah, so Omada Health is a 6-year-old company. We help people at high risk of chronic diseases like diabetes make lifestyle change, lose a bit of weight in the way that the clinical science shows can be incredibly helpful in preventing them from really crossing off that cliff of type 2 diabetes. So it's kind of preventive medicine at scale.
That sounds fantastic. How well are you doing?
It's been awesome.
How many patients?
Yes, we've enrolled over 100,000 participants in the program. We've become the biggest provider of these programs actually in the world. And our vision at Omada is that really our program is essentially standard of care, right? Someone finds out that they have the early warning signs of chronic disease. We try to do everything we possibly can to make sure that they don't progress.
Now, we know healthcare is challenging when it comes to adoption of new technology.
Yep.
How have you pulled that off?
Yeah, it's funny. I mean, I would say the healthcare tech blend is really interesting. When we founded the company 5.5 years ago, 6 years ago, there were fewer companies that were really at that convergence point, right? And you used to find companies in one camp or the other,
right?
And I think that's starting to change bit by bit. I mean, at Omada, it's funny. Our whole product and engineering team come from consumer-forward companies. Our medical team comes from healthcare. Right? Our chief medical officer was the former chief medical officer of Sanofi. Right, deep diabetes company sits right next to folks from IDEO and designers who have cut their teeth in the consumer side. So I think that's starting to happen. I mean, you're seeing digital companies like Omada publishing clinical trials showing the effect of their program.
Interesting.
That's making the clinical world trust digital a bit more.
Right.
And that's the key, right? Proving outcomes, demonstrating trust that actually enables you as an entrepreneur to get closer and closer and closer to, I guess, real healthcare.
Now, a startup founder, that's where you were 5 years ago, just starting out. What is the biggest piece of advice in terms of how did you get those 100,000 patients? Did you go via insurance? Did you go via hospitals, doctors? Talk a little bit about that.
Yeah, I mean, we operate in most categories of, I guess, risk in the U.S. healthcare system, which is self-insured employers, your insurance company, Medicaid, Medicare. I guess the word of advice I'd give is you really need to think about all stakeholders. I mean, the product can be the same, but you have to think how it fits into each one of those. Otherwise, you'll fall short because you actually can't be successful just serving, my opinion, just serving like one niche bit of the market.
Interesting.
For something like what Omada
does.
So we've had to build out a health plan team, a self-insured employer team, a systems team. We do a lot of work in DC to engage with CMS and Medicare. We're doing Medicaid demonstrations, and that's how most life sciences companies would approach the market.
Okay.
Because at the end of the day, if you want to get close to clinical care, you need to figure out how your solution is covered or fits into all those players.
So you get a lot of players so a lot of key stakeholders need to sign off.
No, and it sounds, I mean, focus is king in a startup. It sounds like that would be defocusing.
Right.
They have enough similarities into how they pay. The product's the same that you really need to understand how you fit with all of them, funnily enough.
So how long did it take before you got to your first tipping point? You'd say, what's the time frame like?
I would say for the first year or 2 years of Omada, it was about building the program and publishing clinical studies, right? So once we had data out there in the market, peer-reviewed publications, more coming, more and more data, that really helps enable the tipping point. And then you kind of cross the chasm of going through all the security reviews with health plans and figuring out all the infrastructure and kind of tactics of making it happen. But the first ticket of entry is clinical trial work.
Smart. Now, what's the most exciting solution that you've got coming out?
Well, I mean, what's happening now is, I always tell this to our team in the market, is like the sort of program we've built, it'll never be done. I mean, you don't put this in an oven and set the timer in here, dang, and celebrate. And that's different from life sciences because if you're producing a medicine that gets a clinical outcome, it's frozen in time. Like that is your molecule.
And it ships.
And it ships. And that's it. 20 years of that, right? Yeah. Omada's program is constantly improving. And what's neat is as we've become the biggest provider of these programs, we have the most data. So we have like 15 million weight readings after 3 years, largest longitudinal data set in the world of these programs, millions and millions of other data points. And we're using our data science team to look for patterns in how people are using the program and personalizing accordingly, looking for trends that might indicate that someone's on a path to slipping. We get that to the health coach really quickly. We suggest how the health coach could intervene, and it's creating this feeling. And our participants keep telling us that it's almost like, it feels like magical. Like they don't quite know, but the system seems to just know when they're on the verge of kind of heading the wrong direction, need extra support. Yeah, so I'd say that we're going to keep doing more and more and more of that.
How do you get to the common Jill How do you get to her?
Well, it's funny, we're already there. That's what's one of the things I'm most proud about Omada.
You're at 100,000? Like, how do you go to 10 million patients?
Oh, well, yeah, I mean, so, our big audacious goal at Omada is to see if we can do 1 million enrollment year in 2020. So, to get there, I mean, it's more and more trials, more and more insurance coverage, more and more go-to-market to get enrollments in. But it's, like all those pieces are coming together, and then, the neat thing is our population, we're already serving a population that looks like a lot like, general America. It's, average age is upper 40s, BMI 34, 20% of our participants are less than household income of 40K a year.
Interesting.
It's kind of a really neat thing for me to watch this happen, where our target market is not necessarily technologists in Silicon Valley, right?
Which is good to know.
Which is good.
You won't survive on that.
Yeah, and which is really neat. I mean, we're doing a lot of work in places where the diabetes crisis is really pronounced.
Oh, absolutely. Will you ever go direct to consumer?
Probably not. I mean, conceptually, we could, once reimbursement transpires. Like, you can imagine a world where, we tell you that this program might be covered for you, and here's how to find out if it is. It's not in the works now. I mean, and that is about focus. I mean, really just to make sure. We've always been an enterprise company.
Right.
There's a lot of infrastructure you need to build to do that right, and we've invested heavily in that. And I want to keep the company progressing, and to make sure that it's covered for people who need it.
Okay, no, that makes sense. Okay, one last question.
Sure.
So we know that healthcare and technology convergence is a very exciting yet chaotic space.
Yep.
Now, you've been doing it for 5 years. So talk a little bit about what you saw when you first started. So sort of where you come from, where are you today, and then where do you see it 5 years out, 10 years out?
It's neat. When we started, you had a whole. It's funny. There were a lot of experiments being done, but I felt like none of it was like really doing it right. And I think that's starting to change. And you look at every kind of the layer of the stack that it takes to build a company, and all of it's starting to converge, ranging from talent. You've got more tech folks interested in healthcare now. That's fabulous. That's a great advantage. You've got more healthcare talent interested in tech. That's changing. So talent, right? Investor bases. Right. When I started, it was like you're a life sciences, a life science investor or a tech investor.
Exactly.
And we have people on our cap table where we're the first tech investment they've ever done. I mean, I don't think they've invested in any company that has a software engineer at Omada. Wow. And we have tech investors that we're the first company that's had to run clinical trials that we've ever invested in. Yeah. So now there's more like bridge investors where they may have cut their teeth in healthcare but have tech DNA, vice versa. So that's kind of the second layer of the stack. And then the third is the market. I think the traditional healthcare world is realizing that digital needs to be a foregone conclusion in their product offerings and how they think about serving their constituents, their members, their patients. And they're getting more receptive to new ideas. So I'm in the way that tech can influence the healthcare system. I always kind of call it like disruption in a weirdly non-disruptive way because you got to work with the system. Right. But there are some real meaningful things that are happening, and I think that'll continue in the next 5 to 10 years.
So, do you see a world with zero chronic illness?
I don't. I don't think that's a reality. I think what I do see is a world where the moment that people are identified to be progressing toward chronic illness, there's interventions. And then, maybe 20, 50 years out, but that's likely not a near-term reality, but there's a lot that can be done to reduce the burden, stem the trends. I guess like similar to global warming, you could think of like the chronic disease as a global sickening, right? One of our investors always likes to say, where we've got to adjust trajectory or like tragedy happens. So right now it's about adjusting trajectory.
Yeah, absolutely. Thank you so much. This is awesome.
You've got
Appreciate it.
Take care.